Thank you, Vivek, for the invitation. Am I audible?
Yes, Dr. Very much.
Yeah. So thank you, Vivek, for the invitation. Thank you to Dr. Vijay Patil and Dr. Kumar Pravesh for making this possible. I'd like to introduce our esteemed panel. We have a star-studded panel. I hope all of you are online. So the first is
Dr. Ravi Kannan could not join probably.
Yeah. Okay. No problem.
Yeah.
So I think we have able people. So I'd like to introduce as part of the panel, Shri Viji Venkatesh, madam, who's heading the Max Foundation for the regional head for Max Foundation in India, including South Asia. Dr. Bhavesh Poladia, he's my colleague and a medical oncologist, struggling with us at the last mile of cancer care in the country. And esteemed Shri Priya Dutt for joining us in this discussion. So I'd like to just start off with asking a question. Like Bhavesh and me are young. We are the young people who have just entered into this limelight. I'm like 10 years out of training from Tata Memorial Hospital, gone directly to the grassroots, and working with the public at the lowermost level available in the country. But I want to know from established veterans like Priya ji and Viji, madam, how was this thing 10 years ago, and how is it now? So access to cancer care. So it's definitely a continuum. It would have been better 10 years, but what is the visible change that you have seen in the last 10 years and up to now?
Viji ji, would like to start?
Yeah.
Yes, Priya, of course. If with your permission, I would like to go back to 20 years because it was exactly 20 years ago that access program without any kind of precedent was put in place for a rare leukemia called chronic myeloid leukemia, and I joined that project. And it was something which one had never imagined, that a drug which has to be taken lifelong so that leukemic counts can be kept in place would be donated at no cost to the patient on such a large scale. So this is the drug I'm talking about, is imatinib, Gleevec. I, of course, am with the Max Foundation, and Novartis was our pharma donor partner. So they donated the drug to patients at no cost, and the Max Foundation was invited to administer the program. Today, 20 years later, I'm seeing patients who were maybe 10, 12, 20, 30, 40, 60 years of age. They have lived these 20 years with that extension of life, great quality of life, no financial burden upon the patient. Have things become better? Well, there are not many pharma companies that are working on access to treatment in the same manner that this company, Novartis, worked all those years ago. But I think the idea was seeded. And I think it's the role of the non-profits, and I think the government also has to play a big role, because it is not just the responsibility of the industry. Any access program has to be built on robust partnerships between stakeholders. So yes, the idea was there. It was implemented wonderfully. It was a little difficult to sustain because it is a rare cancer, but today, the Max Foundation is managing the lives of over 22,000 patients who are on this drug, wow, especially just in my region, South Asia region. And other companies are coming to other non-profits. And I think the partnership between the industry and the non-profit is very, very important to build upon.
I think it has. I think you have, built that relationship over the last 20 years, and it shows in your work also. Priya ji, any comments from your side?
Yeah, I completely agree with Viji ji, and so I'm with the Nargis Dutt Foundation, who's worked with cancer care for the last 40 years, And in this duration of 40 years, I've seen amazing changes in India. Now, I mean, it's definitely positive that we have the best doctors, we have the best facilities. At that time, there was not even enough equipment to treat patients. But today, we have well equipped hospitals in place. Access is there for treatment, but access will only happen when there is a diagnosis. Now,
Yes.
people don't have enough access to even diagnose their condition. So, doctor, you would know that many times patients come to you at a very late stage.
Yeah.
So, when a patient comes to you at that stage, cost of treatment will increase threefolds maybe. And I think that is the connect which somehow has to be made smooth. Whereas cancer can be detected early, treatment costs are lowered, and and there is access to very good treatment in our country, and people can live a very healthy life after that treatment. As Viji just said, she's seen people living for 20, 30 years as very normal people. And I think that is where the lacuna is, and we really need to address this issue. We and NGOs play a very key role in that. For us, we are focusing on awareness and early detection. As Dr. Patil mentioned, that the three most prominent cancers in India is breast, cervical,
Breast,
and
cervical.
oral. So, and we also know what the fears in people are. Nobody wants to come to a medical camp to get checked because the word cancer is there. So that awareness, dispelling the myths of cancer is very important. Whenever we speak about cancer with a lot of fear of, अरे किसी को cancer हो गया है अभी बेचारा ये. I think we need to kind of change that narrative and approach cancer as any other disease, which if detected early can be cured. People can have a good life after that. So those are the challenges we face in grassroots level,
Yeah.
Yeah.
Just to thank you I am a product of Tata Memorial Hospital, and every day not a day would go by without entering your contribution to the hospital. And even now I actually visited Tata after a long period of about 7 years, and
Right.
seeing the Nazir Dutt Foundation on the ICU, sometimes it would give me chills because I had so many memories, and
I know.
and all of us are indebted to the contribution that both of you are making. I would have loved it if Dr. Ravikannan was here. He's another, totally a different dream of a person altogether. He would have added so much more for this conversation. Now, coming to Dr. Bhavesh. Now, see, we are people, caregivers at almost the last mile. So, what do you think? He's actually, Dr. Bhavesh is actually a born and brought up Bombay guy. And he's now come with us to a nondescript location, Tamil Nadu, to treat people in this region. And I'd like to ask him, what are the challenges that you have as a doctor? Do people listen to you? Do people even come to you? What is the challenges that you, on a daily basis, what do you feel you face here?
So, thank you. I hope I'm audible. So, basically, it starts with cancer awareness. Like most of the people don't even know what is the incidence of cancer, what are the common cancers for which screening can be done and it can be detected early. So it starts from there. Then once the diagnosis is done, the patients are scared. So the counseling has to be done that there is no scare if it is in the curative stage. And even if it is in the palliative stage, there are so many options which are there to keep them healthy and keep going for a number of years without any problem. So the counseling is a very important part, because without counseling, they will not go to the next step, which is the treatment. Coming to the treatment part, what they want is it should be as simple as possible, and it should be accessible, and most important, it should be affordable. So these are the three factors which comes in the treatment part. And as we all know that cancer treatment doesn't stop after completing the treatment. The observation is an important part of it. The follow-up is an important part of it, because on an average, when we see most cancers, first 2 to 5 years are very important part of their life. where we expect that sometime the cancer may come back. And we have to detect those cancers also early and treat them at with a curative endpoint. So first 2 to 5 years is again one motivation or counseling which is needed so that they follow up regularly. And once beyond 5 years, usually we expect that they are doing very good, and we again continue to follow up, but maybe once in a year. So there are multiple steps at which we do have challenges, and one by one we are taking care of it. And slowly, like I would remember, like 8 years back when I went to Thangam Hospital, my OPD in a month was 30 patients, 30. So it was as low as like one patient in a day, and now it is 300 patients, crossing 300 patients in a month. So slowly it is improving, and patients are coming forward. Relatives are getting the patients for treatment. Many times, even patients were not brought to the hospital because they considered once it is cancer, they have to die. Nothing else has to be done. So step by step, we have seen in last 8 years, things have improved. We have tried to incorporate one by one each and every modality under one roof in the hospital, so that the patient do not have to travel much. So again, traveling is one problem. But suppose if we don't have one particular modality of treatment, patients have to travel. So once they start traveling, they have problems of living there, different type of eating. They don't have home environment. Their family and social supports are cut off. So to see that we have
small place, what we realize actually, with all the support, with we also have government funding through the national schemes. We have help from NGOs like yourself, helping us at the grassroots level. We've come to a conclusion that it is possible to give affordable care without burning the pocket of a cancer patient to almost 60 to 70% of the indications that are present now. The commonest ones, like Priya ji mentioned, like breast, cervical, oral cancer. It's not very expensive. Most of our Western colleagues, they are surprised and they're astonished to see the quality of work that we do, the surgery that we can perform, the treatment costs that we can deliver it at. It is totally possible. This is what we have realized. See, when we were in Tata's, we didn't know what actual cost of treatment was. That is one of the things which we never knew. And the minute you get out and you're working in a hospital in Bombay, it just shocks you like anything on what is being charged. There's no equitable way in which cancer treatments is giving. I'm sure as a foundation you would have had this problem. The same. For example, somebody who's interested in caregiving, the same surgery at multiple. There are multiple options that are available for a patient to get treatment at, from X amount to 20x amount. So coming to that, what we find a big struggle here is cancer information. Before there was no internet, there was less confusion. We say internet increases access to everything. It opens doors to even the lowest rungs of the society. But what we have seen over here is that more information, more confusion. So I think even more than treatment, I think cancer information has to be smoothened out, and the people who are doing good work should be the loudest, according to me. That is one priority in which I feel that we have to work a lot. NGOs can help a lot, and when we came to Namakkal, and even till now, the naturopathy person in Namakkal district sees the most cancer patients than doctors. I'm not against them. I'm not against natural treatments of any kind, but I'm telling you, that is the awareness that is present at the last mile. So forget somebody knowing even about an imatinib. Our people have not heard about imatinib even now. They don't realize that CML patients can live long just with one tablet a day. So what is your take on cancer information? Both Priya ji, Viji ji. Priya ji, you can take it up first.
I think it's most important, and you very rightly said, there is so much confusion because when we get patients, they have got all the information from the internet, and in the bargain, they lose so much time because they're just running helter-skelter. So I think information is very important, and that's where counseling comes in. And, especially of the families, because the patient is in the complete disarray. It's the families who are taking the decision and running to one place and the other, you know. So I think that is extremely important, and the dissemination of information, simplified. You know, I think people need a very simple way to learn as to what cancer is, what can be done, what is the treatment, what's the way forward. If you give them too much material, they're not even going to see it. So I think that has to be made very, very simple. You know, for the common man.
Yeah.
People like you and me who, you know, who can access so many doctors, who can access so much information is fine. But when people who are in the rural areas, their dependence is on the local doctor or the, you know, the local Ved who will tell them, no, I'll make you okay. You know, just have these medicines and you'll be fine. So these are the people we need to target.
Viji madam, you have
I agree completely. I also feel that without right to information, there is no access. And I think a patient has rights. A patient doesn't even know that he or she has the right to know that you know, the diagnosis is a life-altering, life-limiting disease. The right to know where treatment exists, the right to have their voice heard, and the right for access to treatment. And not just access to treatment, like what Priya mentioned earlier, access to means to access, to obtain that treatment. We are still fighting stigma, myths and misconceptions. These are stumbling blocks. It's World Cancer Day today, and the slogan is close the care gap.
Yeah.
Unless we commit ourselves to putting the patient as the focal point at the heart of everything we do, no work we do is going to be effective. So how do we get rid of stigma, information, creating knowledge? These are the tools with which we can actually face this life-limiting, life-threatening diagnosis. Insurance policy. I mean, there are policies, but there's such fine print, a pre-existing condition. And I especially because I'm, you know,
so disheartening.
Thousands of CML patients who are living with the disease, they have a pre-existing condition, no policy for them. Out-of-pocket expenses are simply,
out of the roof.
They destroy the families. You know, in this program, as in many other, there are quite a few other access programs where different companies have partnered with different institutions for different cancers. Patients do not have the resources to come and access the drug which is given to them at no cost. I have had a patient who's supposed to have 600 mg of this imatinib, 6 little tablets. She should come to me every 3 months, and so that she can get her, you know, her reapproval slip and go to her physician, get her BCR-ABL done, or get her normal tests done, and then come and collect next 3 months medication. She comes to me after like 9 months, after a year and a half. And I tell her, "Kya hua? Aap kahan the itne din? You must not be taking your medicine." "Ji nahi amma ji, main roz dawai leti hu. Main roz ek goli leti hu." She's supposed to take six of those golis. Main roz ek goli leti hu. Or there is a patient who tells me, "Mere shohar chote bhai hain. Mere jeth aur sasur kaam karte hain. How can I go and ask my jeth or my sasur, that is my father-in-law or my brother-in-law, for money to buy a ticket to Bombay so I can come to Tata Hospital and see my doctor?" But here also, the patient has a lot of self-respect. This young woman told me, if I could get her sewing machine donated, she said, "Main sari ka fall beading karke, main khud apni ticket kharidungi." So we have to understand that the patient is not helpless. As somebody in charge of, you know, whose role is to counsel the patient, whose role is to foster good adherence behavior, good compliance, we need to understand that the patient also wants to help himself or herself. We have to put ourselves there.
Yeah, so excellent thing. So what another thing which I feel is very skewed in our country is you have a small population of patients or people, you would say, who go to any extent to even have an incremental advantage in their survival or something. And there is such a large population,
Yes.
no means to even get, if to, access a treatment thing which is possible, which will actually cure the patient. It's so skewed. And day in and day out, when we see this, I really feel, sorry for the rest of the people. People just for 1 month, they would spend crores and lakhs of rupees, whereas for a life, they are not able to do anything. I go and take lectures. Actually, I teach people to become entrepreneurs, like doctors. No, we don't know this. Like NGO is an entrepreneurship mindset. To go where there is nothing and make something is what you guys do so well. And I actually teach them to get out of your consulting room comfort or your surgery comfort and try to encourage, get people and things done. So I give lectures, and the first thing is they ask, how do we get funding for
That's the toughest part.
yeah. So, and we have found, I don't want to share it in this forum because then the funding agencies will be in trouble. But, I would have liked to get Dr. Ravi to, he would give information, on how to actually access funding, which is there. I've heard him tell me that, see, we have money to give, but we don't know whom to give to.
Yes.
They want each rupee accounted for. And, I'm sure all of you have the same situation. So, So I think, what is the status of funding for such initiatives? How do you go about your daily foundation activities? How easy it is to get funds for yourself to get things done. I'm sure nothing comes for free. Just give your experience.
Yeah. So funding for us has been very, very difficult, especially after COVID, and the funding that comes, for me, it has been really different because of too many things in the background. Earlier I was in politics, so there was no funding coming in, so there has been a lot of, and now I'm completely, so into this. So we've been really working with individual funding, so CSR has become very difficult because they want, there's a lot of criteria, we need to kind of meet, but things are happening now. But I still feel funding is not as robust as it should be, especially for cancer, where you require that fund. Doctor earlier said that targeted therapy is not even counted.
Yeah, it's not.
And that's a lie. Yeah, there's nothing. It's only chemotherapy, and you're covered with that, even in the government schemes. But today, targeted therapy is like a life-saving situation. When chemo doesn't work, targeted therapy will work. Immunotherapy will work.
And it's not like it's expensive. It's just
Yeah. So that's where a kind of partnership of pharmaceutical companies, the government and NGOs who can become the implementing partner. That kind of thing has to happen when you want to look at scale. Otherwise, as an NGO, we will definitely continue to do whatever we are doing right now and more. Yeah. But I think if you want to scale this out, it has to be a partnership.
I think it has to be organized. I actually
very organized.
Coming to the next question.
If I can just say a little bit about add to what Priya has said about CSR donations. It's very, very difficult. We are all struggling, all non-profits. We don't have that kind of expertise, skills, and knowledge. We don't have the kind of resources to employ people. Professional fundraisers. Yeah. Yes, crowdfunding is there, and we receive donations. Like we receive a fairly large amount, say on the 3rd of March or something, and then by 31st we have to give in a utilization certificate within that time. How do we deal with this?
It's very difficult.
Yeah. Seriously, so what I have started is a very simple, like you said, personal outreach. We started a project called Chai for Cancer. We've raised in the last, this is the 10th year of Chai for Cancer. This is specifically raising funds so that I can support the patients or on this access program to come every 4 months or every 3 months to see their doctors, to pay for their bus fare, their train fare, to pay for lodging, to pay for their BCR-ABL tests, to pay for the schooling of the little patients. And what I do is just tell people, 1 cup of chai, just donate 1 cup of chai you'll be drinking throughout the year. You just donate that one, put whatever value you want to put to it. You won't believe it, in the last, it's not a big amount, but in 10 years, I have raised like 2.5 crores. 10 years, okay.
Wow.
Yeah, it sounds a big amount, but we all know that that is just
I'm
Nothing.
counting the
in
number
the
of
ocean.
chais.
It's a
So
drop
many
in the
chais.
It's
so
a
many
drop
chais.
in the ocean. Yeah.
No, but
Yeah,
it's true. You know, you drink a cup of coffee for 250 rupees today.
Yes,
You know,
Yeah.
every kid is going to
Yeah.
Starbucks.
I'm
or
just
here,
saying,
but
1 cup of chai,
Yeah.
just put 100 rupees into the Chai for Cancer account. 1 cup of
Really,
chai
really.
once in a month, once in a year, one time, just donate your cup of chai. See, people have to take ownership, and a fund, it's as much about raising funds as creating awareness, because people don't know there is this kind of need in the cancer community.
Yeah. So, and I'll end up with one last question to Bhavesh. Sitting at the last mile, we always struggle with the end of life care. Because, when we were in TMH, the mandate was, if a patient is coming from a rural area and he's got stage 4 cancer, just buy him a train ticket and send him back home at the earliest, because he's going to struggle here. He's not going to get any benefit. And it's a miserable life the last 1 or 2 years they're going to have. So, but these patients come to us, the Adyar Cancer Hospital sends patients, CMC, Vellore in South sends patients. They all sends patients. There is no one taking care of the end of life. And it's really sometimes not
terrible.
until it happens to your family member, yourself. You don't understand the pain that the families and people, go. We talk so much about screening, treatment. When we are surgeons, we treat the early cancers. But these are the most, actually, if you look at the population of patients with cancer, this is the largest group. People with cancer, needing end of life care, they don't want pain. They want to just die with dignity.
Pain-free.
In fact, we, the local moratoriums would not take a cancer patient, for the last rites, because thinking that it will spread, the immunization would spread. It is so disheartening to see these things. So we have done a little bit, and Ravi Kannan sir also is doing his bit. So I wanted this question to go to him, but I will end with that because we are, time. And I'm so glad that Bhavesh, our guy, could contribute something. And it was wonderful listening to both of you people who are doing so much for cancer in this country, because it's not just treatment alone. And I always tell, it doesn't take an expert to treat cancer. It actually takes a heart to treat a patient of cancer. And you're the two biggest hearts that I have come to know, and you are still going strong. Thank you for your presence. Thank you, Bhavesh. Thank you to the organizer for giving this opportunity. Thank you, Vivek.
Thank you for having us. Thank you so much.
Thank you.
Thank you very much. Echo all those feelings. Thank you so much. And we missed Ravi a lot today. Yes.
Yeah. Thank you. Thank you so much.
Thank you.